Nowhere in the world is the burden of disease more devastating than it is in Africa. Severe shortages of trained medical staff and inadequate infrastructure hamper attempts to address the many problems. At the end of 2007, the International Finance Corporation showed that sub-Saharan Africa has about 11% of the world's people, but carries 24% of the world's burden of disease. Children make up the majority of the African population, and in turn are suffering the most in this healthcare crisis. Almost half of the world's child deaths under 5 happen in Africa. Healthcare is becoming unaffordable globally. In Africa, the vast majority of the population cannot afford medical insurance. Almost 50% of sub-Saharan Africa's total health expenditure is financed by out-of-pocket payments from impoverished communities. While the South African government has done its best to address the challenges of the healthcare crisis, its resources on all social fields are under enormous strain. In South Africa, the health system is structured into primary, secondary, and tertiary care. Over the last decade, the majority of governmental funding was shifted to the primary health care level as the first point of contact for all state patients. This was an attempt to give all people access to health care, to treat them as close to home as possible, and to reduce the crushing burden on hospitals. There is an increased burden of disease, causing a demand on access at all levels of care. More patients are being referred to specialist training facilities as a result of earlier diagnosis and referrals from primary and secondary levels. A typical example is the Red Cross War Memorial Children's Hospital in Cape Town. This extraordinary hospital is a cornerstone of pediatric care on the continent. It is the only standalone specialist hospital in Southern Africa dedicated entirely to children. The hospital provides life-saving interventions and specialist care to patients from South Africa, Africa, and in some cases, the rest of the world. Since 1956, the hospital has built an outstanding reputation for innovation in pediatric care, training, and research. In association with its close affiliate, the University of Cape Town, as well as ties with the University of Stellenbosch, Cape Peninsula University of Technology, and the University of the Western Cape, it has become the leading center in Southern Africa for pediatric training and research. This has not only advanced child health in South Africa and reduced the burden of disease, but has contributed to the advancement of child health in all developing countries worldwide. The hospital plans to run regional dynamic outreach programs in the future to help reduce referrals and enable staff to focus their efforts on the sickest of sick children. Many of the children treated at the hospital have more severe medical conditions than in the past, and many of the tiny patients have multiple diseases and very advanced stages of pathology. Currently, the hospital manages approximately 250,000 patient visits annually. The vast majority of these sick children are from the poorest and most marginalized communities. A third are under a year old, and many are HIV positive. There are 290 beds for inpatients and 73 specialist outpatient clinics. The Red Cross War Memorial Children's Hospital is respected the world over because of its significant contribution to global child health. Groundbreaking work includes the first open heart surgery on a child and the first pediatric heart transplant in South Africa. The first liver transplant program for children in Africa was started here. It was also the site of the first combined liver and kidney transplant on a child and the first successful separation of conjoined twins in South Africa. With the new government in a funding crisis at the time democracy came to South Africa in 1994, the Children's Hospital Trust, the independent fundraising arm of the Red Cross War Memorial Children's Hospital, was established to help support the hospital. Through complementary funding, we now have an African teaching and training health facility that has managed to stay abreast of the world's developments in child health care. As a public benefit organization, the Children's Hospital Trust has an impeccable record of sound financial administration and good governance. 100% of all donated funding is spent on improving and supporting the hospital. Over the years, The Children's Hospital Trust has raised millions of South African rands to provide facilities that support the incredible work done at the hospital. The most recent project, and the Trust's largest to date, was the construction of a new state-of-the-art operating theatre complex which opened on time and on budget in September 2009. This has enhanced the hospital's reputation as a center of excellence, allowing it to improve pediatric and surgical services and keep them on par with the very best the world can offer. Fully digitalized theaters, a modern digital lecture facility, and plans for a new surgical skills training center all form part of the hospital's dynamic multidisciplinary training hub. This teaching platform will assist other African nations to develop and improve their pediatric surgical skills. Specialists from countries such as Kenya, Malawi, Zambia, Zimbabwe, and Uganda will train here and return home with new specialist skills to benefit their own country's healthcare. Distance learning programs are planned for the future to further strengthen the hospital's outreach program. The hospital also provides direct support to many doctors and specialists working in hospitals throughout sub-Saharan Africa. But whilst the hospital is a center of excellence, it now requires even more support. Over and above the operating costs, which are wholly funded by government, vital needs have been identified by the hospital. Many of these cannot be funded by government currently due to the demands of the primary healthcare services. This is where the Children's Hospital Trust steps in to provide critical additional funding. Through ongoing collaboration with donors, investors, and other stakeholders, the Children's Hospital Trust continues to develop its long-term strategies in line with the hospital's many needs. These strategies are most often designed to suit the requirement of developing countries. They are all projects chosen because they are sustainable and will have optimal impact on the health care for children on the African continent. We need your support. Please partner with the Children's Hospital Trust and join us as we identify opportunities to improve the quality and accessibility of healthcare for children in Southern Africa. Join us as we work to address one of Africa's most compelling challenges. Visit www.childrenshospitaltrust.org.za.